just called the nurse. They should be in the room. All right, that's fixing it. All right, do you need anything from us? No, thank you.
My name is Dr. Al Torres. I'm the Chief of Critical Care here at Nemours Children's Hospital. The ability to have audio-visual communication with any patient room in real time is phenomenal. What's happened in modern hospitals is patients are spread out even farther than they used to be. They're all private rooms. So for a nurse to hear a monitor alarming from a room is challenging at best. Any alarm that is concerning to the paramedic, they can audiovisual into the room and assess the patient instantly.
For the most part, we use the clinical cameras for the physiologic monitoring, putting the action of the patient with what's going on the monitor. Because as clinicians, we were always taught in school, never treat the monitor, treat the patient. The one that stands out in my mind is our very first success story, I call it, in that we were able to notify the code blue team when there was a patient having a seizure, and it was literally at the moment that the patient started to have the seizure that we were able to alert the team. Normally that would take a significant amount of time for the nurse to even possibly realize that the patient is having a seizure, because if there's no alarms being set off or anything like that, the nurse would never know.
We also had an instance where a child was having a change in vital signs that was difficult to explain. The patient's oxygen level would drop, the heart rate would go up. So the next time it happened, we turned on the camera and it turned out that the caregiver was trying to smother the baby. So having the ability to audio video into the room, we were fortunate to catch this person early before they could do significant harm to the baby.
The Tactical Logistics Center was kind of the brainchild of Dr. Stephen Lawless here at Nemours, and he had the thought that to be able to provide that third level of monitoring for our patients, that extra layer of support and extra eyes and ears, as we like to call it, would be extremely beneficial.
There's a camera in every patient room at the hospital, and the camera is focused on the patient bed. So we've zoned out all the other areas within the patient room. It's strictly focused on the patient, and that allows us to get an insight onto how the patient's doing.
We have in each and every one of our rooms a red LED light that alerts the family that the camera is actually on.
By meeting a few application engineers and other folks with access, they really introduced me to the larger line of products that you never quite know what the use cases are till you really kind of put your hands on what they have and see how they work. Once I looked at their interface and how it actually communicated with the camera and the configuration settings, we were actually able to customize it and fine-tune the cameras to really provide kind of a flawless, seamless integration and the true frame rate, the true resolution to provide the clinicians with the best tools that they need to provide care to the child. It just adds more time to really connect to that child and truly understand what it's going to be to help them get healthier.
I've had one patient, a 9-year-old girl. We'd had this bond where I would watch her, and every break I'd go upstairs, and she knew who I was. We'd go downstairs and play, and then I'd bring her back up and go back to work. So we kind of have bonds with patients that they hear our voice, we monitor them, we go and start things. So it gives us the credibility and the likeliness that someone's watching me and I like who they are.
The ability to assess someone instantly results in them getting attention much quicker. Getting help to that room right away has resulted in more of a preemptive response than a reactive response. It definitely was not as safe an environment as it is today because of the use of technology.